There are oodles of poodles out there in the world, and their crossbreeds are becoming increasingly trendy lately, thanks mostly to their non-shedding coat. It helps that poodles are quite likeable dogs, but mixing two breeds does not guarantee hybrid vigour, especially if the two breeds are prone to the same illness. So it's wise to know what conditions both parent breeds are prone to, so that you can be prepared before adding a poodle mix to your life. My name is Dr. Ferox, and I'm a general practice vet. I see these dogs every day, and these are the conditions I see most commonly. But firstly, I do need to thank my very generous blog followers who have contributed footage of their own poodles to this video. It's always lovely to see other people's pets. And secondly, I do need to specify that I'm not bagging out poodles in particular with this video. All breeds will have health problems, some are healthier than others, but none are perfect. And just because a problem is common within a breed, there is no guarantee that an individual will or won't get it. It's more a matter of deciding what problems you are willing and able to manage in your furry companion, and being aware of them so that you can manage them when they first show up, and not further down the track when they become more complicated. There are 3 accepted sizes of poodle. The largest is the standard, then the mini, and then the toy. I'm going to discuss all of them in this video, though some conditions will be more common in certain sizes than others. They do also share some conditions due to their relatedness. Teacups are just something you do not want to go near. Poodles very commonly have hairy ears, and that hair can trap moisture, predisposing to ear infections. This is particularly common if the hair is allowed to knot and then form into a mat in the opening of the ear canal. Some poodles are perfectly fine, but many end up with chronic ear issues. It's debatable whether plucking those ears help or not, because plucking the hair causes inflammation down the ear canal, which causes more moisture, which will again feed the ear infection. Tooth problems are also extremely common in poodles, with most of them requiring at least a dental scale during their lifetime, but many of them losing multiple teeth. They're very prone to periodontal disease, especially if they're fussy about chewing things or resistant to having their teeth brushed, but are also prone to base narrow canines. In this anatomical condition, the lower canine teeth sit too close to the tongue, so they actually stab the roof of the mouth each time the dog closes its jaw, causing pain. This can be costly to fix and may involve removing otherwise healthy teeth, but you can often see it when the puppies are sort of 8 to 10 weeks old, so before you choose one to bring home. Poodles are very prone to warty skin growths, so prone, most of which end up being benign sebaceous adenomas. Although they are benign, which means not cancerous, they are frequently very annoying and can be damaged by clippers when grooming. They arise from the oily glands of the skin and can show up basically anywhere, with most dogs often having many of them in their senior years. While they're relatively simple to remove, they can become so numerous that you need to decide which ones are actually worth removing, just because there are so many. In general, I tend to remove them if they're interfering with normal anatomy, bleeding frequently, bothering the dog, or growing bigger than a fingernail. Heart murmurs due to mitral valve disease are more common in the smaller poodles as they age. It will eventually lead to heart failure, but typically takes much longer than something like a cavalier. It's usually managed medically, and once it's diagnosed, it will mean lifelong medication. Sebaceous adenitis is a weird inherited condition where the sebaceous glands of the skin become inflamed and eventually shut down, leading to hair loss and predisposing to skin infections. Breeders can avoid this by not breeding from affected dogs, although some dogs will have a subclinical case which is only diagnosed with a skin biopsy. It's a bit tricky because it can look like multiple other conditions. Being fairly long-lived dogs, it's no surprise that these critters often end up with renal failure, aka kidney disease, usually in their most senior years. These dogs can be fussy with their food at the best of times, but modulating the protein in their diet may help slow down the condition. It's possibly also predisposed by older poodles needing to be on either anti-inflammatory medication for joint issues or frusemide for late-stage heart disease, both of which hasten kidney disease. Speaking of joint issues, medially luxating patellas are when the kneecap is popping out of position towards the inside of the leg, and it is particularly common in the smaller poodles. In fact, the smaller the dog, the more common it is. So toy poodles get it by far the most commonly of the three, and standards get it very rarely. Most of these dogs will benefit from surgery, but they all benefit from preventing obesity. Anal gland problems are another condition that becomes more common as the individual dog is smaller, with the tiniest dogs tending to have the most frequent anal gland impactions or anal gland abscesses. While they can be managed with regular expression, they are messy, stinky, and uncomfortable. While the dogs themselves are reported to be hypoallergenic due to their non-shedding coat, which is not always the case because I myself am lucky enough to be very allergic to several standard poodles, the dogs themselves are frequently allergic to something in their life, and my experience is it's usually been grass of some sort. Fortunately, cytopoint injections have been a real game changer for managing these allergies, but there are other conditions that resemble allergies and are harder to diagnose. Addison's disease is one of my favourite diseases, and it is more common in poodles. To my knowledge, there is not yet a genetic test to see which poodles are prone to it or likely to pass it on, but this always seems to be actively in development. Addison's disease is caused by a lack of adrenal function, so a deficiency in either the glucocorticoids or mineralocorticoids, and it is lethal if not treated. Screening for breeding stock is a little bit complicated compared to desexed dogs because gonads will produce low levels of the otherwise missing hormones. That means a dog who is not desexed may develop Addison's disease much later in life than they otherwise would have. Although it's lethal if untreated, it is relatively straightforward to manage. The hard part is diagnosing it because it can mimic multiple other conditions. On the opposite end of the medical spectrum, we have Cushing's syndrome, where the body overproduces cortisone, and it's usually associated with a functional tumour. Affected dogs are often very hungry, very thirsty, and if untreated will become dramatically bald along their body. While it's not immediately lethal, it does impact their quality of life, and it is expensive to treat. Epilepsy is more common than average in poodles, and it does seem to run along family lines. Unfortunately, there isn't a genetic test for it, but most epileptic poodles are managed fairly well on medication, although it is for the rest of their life. Like many purebred dogs, the eyes of poodles have the potential to become a real mess. I would like to think that breeders are screening their stock where able and getting eye certificates from veterinary ophthalmologists, because poodles are prone to glaucoma, where the pressure in the eyeball gets high and painful, microphthalmia, where the structures of the eye are built just too small, cataracts, where the lens develops a hard crystalline appearance too early in life and causes blindness and sometimes pain or secondary glaucoma, optic nerve hyperplasia, where the nerve that transmits visual signals to the brain is too small, possibly progressive retinal atrophy and retinal dysplasia, where the light-sensitive cells at the back of the eye either degrade too fast or were built wrong in the first place, and corneal dystrophy, where the transparent front of the eye is built wrong. These fluffy dogs also get entropion, where the eyelid actually rolls inwards to rub furry skin against the eye, or ectopic cilia, where there are eyelashes or fur straight up growing off the wrong side of the eyelid. In poodles, this might not be diagnosed straight away because at least their hair is soft, but it will eventually cause irritation. Dry eye, also known as keratoconjunctivitis sicca, gets a special mention for being yet another condition where glandular tissue isn't working, in this case the tear glands, resulting in eyes that dry out and cause secondary problems. Tear duct atresia also gets a special mention, as some of these dogs will have permanent overflow of tears onto their face due to an inadequate tear duct. Some of these conditions you can spot in puppyhood with either persistently wet faces or watery eyes, or visibly small eyeballs, but others won't develop until later in life. Hypothyroidism is a hormonal condition characterized by a lack of thyroid hormone. It's fairly simple to manage medically, but the hair loss, weight gain, and lethargy can look very similar to a number of other conditions on the list, and it can also be mistaken for simply old age. Collapsing tracheas are much more common in the smaller dogs, and once again the toy poodles get this most commonly. The cartilage rings of the trachea begin to weaken and sag with old age, and this results in a chronic cough, which is worse with excitement. Severely affected dogs will faint from coughing, and the symptoms also get worse with excessive weight, as it is very easy to overfeed an adorable little lap dog. This is often a factor. The cough from a collapsing trachea sounds quite a lot like the cough from heart failure, so don't assume it's one or the other without getting it checked out. And yet again, the smaller poodles are also at risk of intervertebral disc disease, which can present with back pain, limb weakness, or paralysis. Often there will have been a physical incident, such as jumping off a couch, the breed is also prone to diabetes, and I'm not convinced that diet is always a factor. I've watched sibling dogs live the same life in the same house, be fed the same food, only for one of them to develop diabetes in middle age, but not the other. The condition will require insulin injections to manage, which, while achievable, is expensive. Gastric dilatation volvulus is when the stomach twists on itself, cutting off blood supply and the esophagus and the intestine. It is a life-threatening emergency, and for a change it is the larger poodles that are prone to this, especially standard poodles with big, deep chests. Again, it is the larger poodles which are more prone to hip dysplasia. I haven't seen this as a massive issue within the breed, but it is something that breeders of standard poodles should be screening for. Von Willebrand's disease is a clotting disorder, and there are a few other rarer clotting disorders which can occasionally pop up in poodles, although they're not common at all. Immune-mediated hemolytic anemia and immune-mediated thrombocytopenia are, funnily enough, immune-mediated conditions where the body attacks its own red blood cells or platelets respectively, and they are reported as being more common in poodles, although they're nowhere near as common as in breeds like the Cocker Spaniel. However, if you are crossing a poodle to a Cocker Spaniel, the resulting puppies are not going to be more resistant than either parent. Bladder stones are a fun one. I've had at least half a dozen cases where I've x-rayed a poodle for an unrelated reason and accidentally discovered bladder stones. Sometimes they will go on for a long time without symptoms, but unfortunately the majority of cases I've seen have not been struvite stones, which means we haven't been able to treat them without surgery. Patent ductus arteriosus is a rare but major congenital heart condition where an embryonic blood vessel has not closed after birth. Puppies often present with a heart murmur that sounds and feels like a washing machine, and this is an expensive and potentially heartbreaking problem, though thankfully very rare. Hydrocephalus has been reported as being more common in toy poodles, although my suspicion is it's mostly in teacup lines, which occur when you take an already very small dog and are breeding the smallest of the small into what are functionally ridiculously small dogs. They are also ridiculously sick dogs. Toy poodles are already small enough, you do not need to breed them even smaller. And lastly, although it's not purely a medical condition, I do end up treating a lot of poodles for anxiety. While partly this is due to how they are socialised as puppies, it's also due to their high intelligence. Poodles are fairly clever dogs, and they will overthink, and they will pick up on their owner's behaviour. If their owner is anxious, they will emulate that. A separate issue with poodles is the age of desexing, as for a while many breeders were selling puppies already desexed by 12 weeks of age. This was due to the popularity of poodle cross dogs, as many breeders rightly feared their puppies would end up as breeding stock in puppy farms, which they considered torture, and desexing before sale was a sure way to prevent that. My personal preference is that dogs be desexed later than puppyhood, but I can absolutely understand why those breeders made that decision. You're weighing up potential future health problems versus a possible horrible life. They're pretty good dogs, really, and fairly hardy, if you can keep the dental health under control. Many poodles manage to live and thrive into their late teens, although you will have to keep up with maintaining their coat. Thank you for watching this video. If you'd like to suggest the next breed for this type of health review, you can leave a comment below, and my lovely Ko-fi supporters will vote during the coming weeks. I'll see you next time.